Good evening, everyone. So today I'm going to present you our AI-powered casual care AI, which is a prediction model that is used to uh, predict the diseases based on the symptoms and give you suggestions about the particular disease. So let's see by starting the demonstration. So we have lifestyle factors. So we need to set our lifestyle factors. So do we smoke or not? How long do we sleep? And what is the pollution level of the area that we live in? So let's start with a simple symptoms of my personal experience. So I don't smoke, so I'll set it to no. And I sleep 8 hours a day. And I live in Kathmandu, so I'll set the pollution to high. So now I get of symptoms like itching and skin rash. So if I analyze it, so the disease is fungal infection, and I do have a fungal infection. So what it is showing is I have a fungal infection disease which severity is mild, and the risk factor is adjusted based on the lifestyle factors that we had given, which in my case is pollution and the current disease. So if I reduce the pollution, or if I stay in a less polluted area, or if I use some air purifier, so the risk of the infection will be reduced by 0.8%. So overall improvement will be of minus 0.8%. So this is not contributing that much to the respective disease that is shown. So then we have this personalized recommendation engine, so where we give the personalized advice. So in my case, the personalized recommendation is this condition is generally manageable with self-care, maintain healthy habits, and consult a doctor if symptoms persist or worsen. And advice for fungal infection: keep affected areas clean and dry, wear breathable fabrics and change socks, and avoid sharing personal items like towel, combs, or shoes. So this is the best advice one can get for the fungal infection. So, and there are some general lifestyle tips as well. Sleeping to a healthy range, staying hydrated, and along with that, physical activities also. So then we have risk awareness. So in risk awareness, our model is suggesting us living in a high pollution environment puts additional stress on our body. So consider using air purifiers and limiting outdoor activities on days when air quality is poor. Also, fungal infections are common and usually respond well to topical treatments. So this was a simple disease prediction for me. Let's see another symptom and let's predict the disease and get the suggestions. So for example, if someone is um, suffering from, so let's see some symptoms. So let's do weakness in limbs and chest pain, congestion, and sinus pressure. And this time the user also smokes and lives in a very highly polluted area, and he has a poor sleeping habits. So let's analyze the health risk. So if we analyze it, we get the disease prediction as common cold, which is not severe at all, because common cold has the disease severity of mild, because that is not that dangerous of a disease. So base probability is less, but since the user smokes, the smoking habit is adding the risk percentage. So that's why the overall risk factor increases to 39.9%. Now we don't need to worry. So this is the risk percentage, and now we can see that if we quit smoking, we can reduce the risk, and if we improve our sleep, we also reduce the risk, and if we reduce the pollution, we can still reduce the disease effect. So this is how our model is suggesting us how we can manage risk as well. So now let's see for the personalized recommendation and advice for common cold. We can see stay hydrated with warm fluids, rest well, and use steam inhalation, which is the best advice one can get for common cold. So this is the overall model. So what we are addressing is many of the AI healthcare products, they predict the diseases, but we don't get personalized suggestions, so we don't know what to do. So our application, it suggests us some of the advices, and in major diseases such as heart attack or severe conditions such as AIDS, it suggests us to visit the doctor, and it doesn't suggest any further, because in that case you need to immediately see the health experts, and in no means we are trying to replace a medical expert from our application. We are just creating it so that user can check the severity of their disease and decide when to go to the hospital. So this is the overall demonstration. Thank you so much.